Today topic is what is physiology pharmacy? Physiology is the study of how living organisms function, while pharmacy involves the preparation and dispensing of medications. The connection between these two fields is essential in understanding how drugs interact with the human body and how they can be used to treat various medical conditions. Let us discuss some key points related to physiology and pharmacy. Number one, drug pharmacokinetics and pharmacodynamics. Pharmacokinetics deals with how the body processes drugs, including absorption, distribution, metabolism, and elimination. That is ADME. Pharmacodynamics focuses on how drugs exert their effects on the body. Understanding these aspects helps pharmacists determine appropriate dosages and predicts how a drug will act in different individuals. Number two, drug interactions. Knowledge of physiology is crucial in predicting and managing drug interactions. Some drugs can affect the absorption, metabolism, or elimination of other drugs, leading to potential complications. Pharmacists need to be aware of these interactions to prevent adverse effects. Number three, drug formulations. Physiological factors like the route of administration, patient age, and medical condition influence the choice of drug formulation. For instance, a person who has difficulty swallowing might need a liquid or chewable form of medication. Number four, pharmacogenetics. Genetic differences among individuals can impact how they respond to medications. Pharmacogenetics involves studying how genetic variations affect drug metabolism and efficacy. This information helps pharmacists tailor drug therapies to individual patients. Number five, patient education. Pharmacists play a crucial role in educating patients about how to take their medications properly. This includes explaining the physiological mechanism behind drug actions, potential side effects, and how to manage them. Number six, compounding. In some cases, a patient's unique physiology may require custom made medications. Compounding pharmacists create tailored medications based on a patient's needs, considering factors like allergies, dosing preferences, and route of administration. Number 7. Therapeutic monitoring. For certain drugs, monitoring physiological parameters such as blood pressure, blood glucose levels, or drug concentrations in the bloodstream is essential to ensure the medication's effectiveness and safety. Number 8. Adverse reactions. Pharmacists need to understand how medications may affect various physiological systems and be able to identify potential adverse reactions. Number 9. Chronic diseases. Many chronic diseases like diabetes and hypertension involve disruption in normal physiological processes. Pharmacists need to understand these underlying physiological mechanisms to effectively manage drug therapies for such conditions. Number 10. New drug development. When new drugs are developed, understanding the physiological targets and mechanisms of action is essential for pharmacists to evaluate their potential benefits and risks. Overall, the field of pharmacy is deeply linked with physiology. Pharmacists with a strong understanding of physiology can provide better patient care by ensuring that medications are prescribed, dispensed, and used in a way that optimizes therapeutic outcomes. At the end, as usual, you are requested to subscribe my channel Javed Khatak Pharmacy and also like and share this video. Thanks a lot.